good morning, good afternoon, and good night for some people. So I want to welcome you to the webinar on Towards Universal Social Protection, Latin America Pathways and Policy Tools. My name is Alicia Spengler. I'm a Senior Project Officer at IPC-IG, and I'm moderating this webinar. So IPC-IG, ECLAC, and Ipea would like to welcome you once again and thank you for joining us today. The webinar is exploring the content of the book with the same title as the webinar, which was published by ECLAC in 2015. This book details and debates the right-based public policies, programs, and regulatory frameworks that are being used to expand social protection coverage and benefits in Latin America. Our key speaker is Cecchini, who is one of the authors or the main author of the book, and he will present the publication and highlight some of the main topics it addresses, and Sergei Soares will be the discussant of this presentation. So Simone is Social Affairs Officer with the Social Development Division of the United Nations Economic Commission for Latin America and the Caribbean, based in Santiago, Chile. His research is characterized by a multidisciplinary approach and a focus on equity and human rights. He has been the preparation of various institutional reports on development, poverty reduction, and equity. And he has edited a series of publications on social protection systems in Latin America and the Caribbean, covering 21 countries of the region. So prior to his he was at World Bank's Poverty, combined quantitative and qualitative data to analyze the socio-economic performance regions of the world, and performed evaluation and research field work on use of information and communication technologies for poverty reduction in rural India. So I would also like to invite you all to share your questions through the chat, so that after the presentations we can forward the questions to our speakers to answer the questions, okay? So now I will pass the word to Simone Cecchini to start his presentation.
Thank you, Alicia. Good morning or good afternoon to everybody, and thank you to the socialprotection.org website for giving us an opportunity to share this new ECLAC book on Towards Universal Social Protection. And also it is an honor and a pleasure to share this web seminar with Sergei Soares from Brazil. The book intends to show the progress made and the challenges that remain to broaden the coverage of social protection, both in terms of population reach and quantity and quality of the benefits. I hope that everybody can see the presentation on the screen. Okay. No, you cannot see. One moment, I'm just asking for some little technical help here. One moment. Okay, but in any case, before I put the presentation on, let's continue. It is indeed a large book, and I will not be able to go over the entire contents, but in any case, you can download the book. It's for free, available on the ECLAC website, and also through a link or website. After a short introduction, I will touch degrees of depth a few of the issues that okay, now I think I can share my presentation. Yeah. Okay. These are some of the key issues touched upon: the relationship between social protection and development models, the right-based approach to social protection and social protection along the life cycle, the innovation and expansion of social protection in Latin America, coordination issues, and the compacts and financing for social protection. Basically, this book intends to be sort of a toolkit for policymakers at different levels in the state apparatus, which want to follow a right-based approach to expanding social protection coverage and allowances in Latin America. The analytical perspective of the book is grounded in a rights-based approach, on a life cycle approach, and the vision is one of comprehensiveness and a systemic vision of social protection. What do we mean by social protection? Social protection is part of broader social policy, and basically it has the goal to guarantee a basic level of welfare to all citizens and to ensure against risks that arise from the context of the life cycle and moderate or repair social harms that occur when social problems or risk materialize. A key point is that social protection does not only protects against risk that the whole population face, say unemployment, sickness, but also it's a response to structural problems in society, such as those of poverty and inequality. The book has been edited by myself, together with Fernando Figuera, Rodrigo Martinez, and Cecilia Rossell. Here in the next two slides, you can see the structure of the book, which is separated in three parts: one introductory, one on the life cycle approach, and one on cross-cutting issues which are key to building social protection systems, and you can see the names of the authors. One very important point is that social protection tools do not exist in a vacuum. Social protection tools depend on and are influenced by the development model that exists in the countries. And so here we list a few variables that influence how social protection shapes within countries. There are structural values, structural factors such as the economic, demographic, and social level of development. There are political factors, the political system, the distributional coalitions within countries, the power groupings that exist, and also important to mention technical variables that influence social protection. These are referring to the technical and bureaucratic capabilities and contents. The book goes over also a historic perspective of social protection in Latin America and the Caribbean through the centuries, basically looking at how social protection connects to the development model and to the vision of the state that exists in each period. And if we start looking at the first period of independence, basically in this first period, the social question came down strictly to a problem of control and philanthropy, but progressively over time, social policy began to develop, especially in terms of education, access to health, and the first insurances for civil servants in the state apparatus. This continued in the early decades of the 1900s, and then after the Great Depression in 1929, Latin American countries adopted the import substitution model in terms of economic development, and this is the period when countries begin to build the welfare state. This means that there was an expansion of mass education, broader access of healthcare systems, and in social security, basically insurances were expanded to cover urban formal sector workers. This was a great expansion, but it left out mostly the rural population and the poor population. This was the great limitation of social protection policies in this period. If we look at the successive period, which was the period of the debt crisis and the structural adjustment, we see that the focus shifted to avoid the problems and inefficiencies of social policies. The structural adjustment period was characterized by decentralization, for instance, of the education system, by privatization in pensions and in health, and social assistance became focused on the extremely poor, and it was basically an emergency measure. Then we come to the current model. We live in a globalized world, and countries in Latin America have made great efforts to increase social protection coverage. These went together with the democratization of the region and also with economic growth. So we saw the expansion and supply of the ages covered by education, increased access to health services and insurance, as expansion of retirement and pension coverage, and in social assistance we see a shift from emergency issues to breaking the intergenerational reproduction of poverty, mainly through cash transfers to families with children and to the elderly, and with the adoption of broad poverty reduction strategies. And also some progress was made in workers' protection. One key message of our book is that the goal of public policies is facilitating a greater fulfillment of economic and social rights. To do this, the state has to play a primary role in reducing socioeconomic inequalities. Obviously, this role must be sustained by a fiscal covenant and by redistributive policies, which progressively increase the benefits and the thresholds. Social protection is a basic right to participate in society, and the rights-based approach gives social policies an ethical grounding to progress towards a greater equality. Two ideas are strongly connected with the rights-based approach: equality on the one hand and citizenship on the other hand. As the philosopher Norberto Bobbio says, the rationale that underlies the human rights to education, health, or work is eminently egalitarian. The idea is that economic and social rights seek to reduce inequalities between the rich and the poor and place a growing number of people on a better footing compared to the better off. Then we also highlight that achieving the realization of social rights of all citizens are actually included in development and enjoying well-being. This implies genuine belonging to society, what Marshall called social citizenship. Thus, we see poverty not just as a lack of income, for instance, but also as violation of basic human rights. Now, there is a big discussion of whether this right-based approach is too strict. But we believe that the right-based approach does not prescribe the precise content of social protection policies, but rather it offers a general direction through its essential. Which are the essential elements of rights-based public policies in social protection? Well, first, equality and non-discrimination, meaning obviously that social protection policies and programs cannot discriminate by race, age, ethnicity, gender, but also that they must be truly transformative and universal in the sense to benefit all citizens. Now, we are also aware that economic resources and also institutional resources are limited, and thus there is the element of progressiveness. We can advance towards universalization in a progressive manner, and also no regressiveness. That means that if crisis hits our country, we shouldn't go back, we shouldn't automatically cut social expenditure, and we should protect our social protection system. Another principle is comprehensiveness. We know that human rights are interconnected. We have to satisfy at the same time the right to social protection, to health and education, and this imposes on public policies being coordinated among sectors and different levels, a comprehensive view. The institutional framework means that any policy must be grounded on the Constitution, on laws, on strong state apparatus, and also obviously following a right-based approach means that citizens have to participate. We shouldn't just design policies and programs in an office in the capital, but we should hear and include as much as possible citizens, be transparent, give access to information, and be accountable. Is this only rhetoric, or do we see in Latin America some of these elements being put in practice? We have done this exercise, and we find that there are some good examples of bringing the rights-based approach into practice. For instance, with respect to universality, we see countries such as Brazil that have set up a universal health system, and also we see inclusion of disadvantaged group in monetary transfers from which they were traditionally excluded. And some of these monetary transfers, be they for children or older adults, some already tend towards universality, and you can see the examples on the slide. On comprehensiveness, we see countries like Chile and Brazil that adopt integral strategies. For instance, Brazil's Without Misery has a transfer pillar, a social services pillar, and the labor inclusion pillar. Also, we see progress towards the consolidation of suitable legal and institutional frameworks. Again, Brazil, from the Constitution in 1998, then had an organic law on social assistance in 1993, and then a new social development ministry, and this happened in many other countries. We see as great news this setup of social development ministries. Also, it's important to mention Mexico's 2004 General Law on Social Development. Other examples, participation. Once again, in Brazil, we see participations by citizens at different levels, both on the discussion on social assistance policies, on health policies. Transparency and access to information has improved for those participating, for instance, in conditional cash transfers. You have phone numbers you can call to if you have something to say about the program that is not going right. And also there are measures fostering accountability. For instance, in Peru, the National Supervision and Transparency Committee is made of independent citizens who oversee the progress of the program. In this chart, what we see is the following message in terms of rights-based approach. Economic and social rights are included in most constitutions in the region. Also, they are included in the social protection discourse, meaning the rights-based approach is mentioned in national development plans or in official documents on social protection. However, there are fewer examples Okay. I hope you can hear me now. Probably the connection was lost for a while. Now, we also have to be clear that the rights-based approach to social protection faces some great challenges. There is the challenges of judicialization, which means the poor and vulnerable have less access to solutions in court, burden on the judicial apparatus, and sometimes the executive feels threatened by the judicial taking over the design of social policy. However, judicialization, as we can see in the Colombian case, can have also a transformative effect on overall country policies. There is obviously the challenge of financing. There are multiple demands. The resources are scarce, but here the message is to make use of maximum resources available. For richer countries, you have to look at fiscal policies for more redistributive. For poorer countries, also using cooperation. But we also have to take in mind the issue of the cost of not doing anything, the cost of not protecting the population, of sustaining these efforts with social. Great discussions exist on conditionalities and targeting. Just brief messages. On our side, we believe that it is important to avoid strict conditionalities and punitive sanctions on poor people, and also that targeting is the tool and universalization is the goal. Now, the approach, a life cycle perspective. The families, people, communities do not relate to social policies piecemeal when they face problems and risk, and they look to take up the whole welfare opportunities available. However, we know that the state apparatus very often is fragmented, and policies and programs are characterized by strong institutional boundaries. This is thus something that we still have to work on to really realize the population. Now we can see the book is divided into different stages of the life cycle. Here we have a slide on the first cycle of the early childhood and childhood, and in Latin the big message is that we have seen expansion of coverage of the tools that exist already, and also adoption of new policies and programs. Online you can see this chart where you see the broader coverage of conditional cash transfer programs, both in population terms and both in terms of expenditure. So cash transfer programs have been, but also there are innovative policies for child health and expansion of preschool education services and the lengthening of the school day. Obviously, huge challenges exist. For instance, it would be important to families with children below 5 years old, because that poverty is concentrated still among families with children. Better coordination with sectoral policy, extension of care services, and the linking some of the benefits from contributory tax. Adolescence and youth is one stage of the life cycle where in Latin America and the Caribbean we do not see a focus of comprehensive sustained efforts under the umbrella of social protection systems. Good achievements, the development of job and first policy, access to reproductive and health services, middle school, and also in some cases high school have been made mandatory, but we still have so many challenges on health, addressing the specific morbidity and mortality profiles of adolescents and youth, for instance, because of prevalences of accidents, violence, drug and alcohol, we need to enhance the links between the monetary support and the active labor market policies, and also the quality of education is an issue. Reproductive years stage, we see that many countries in Latin America provide sickness and work accident insurance. However, progress and coverage of unemployment insurance is still low. On health coverage, and there you have a chart country by country showing that coverage by health system of wage employees have increased over the last decade. It is still far from universal, but have expanded. Formalization has increased, and still labor regulation is an area of crucial challenges, as we can see in Chile with the labor reform right now in place. With respect to active labor market policies, these seem to be one of the key challenges for social policy and social protection, and great challenges remain for training, mediation services, and job creation policies. And although conditional cash transfers have expanded, there is a challenge to have this transfer also for families that are not eligible for CCTs, but still that they face unemployment or disability. Getting to old age, we have seen in the region a great expansion of non-contributory pensions coverage, although the amounts of the allowances in many countries are still low. The chart in this slide shows extension of coverage of pensions for people aged 65 years and older. On health coverage, again, we see progress and also some specialized policies for old age healthcare. However, little progress has been made in policies for old age care. Setting up care system is a big challenge for the region. Just a few quick messages on cross-sectoral coordination. As I said, all too often the different sectors involved in social protection related and coordinated. We need a common vision. We need some organic suprasectoral structures. And what in the book see that are tools that have helped to achieve closer coordination are participatory strategic planning, social information systems, that is the true backbone of any social protection system, and on which countries like Brazil, Mexico create strides. The importance of policy management at the local level, because social policy, after all, to get to citizens, have to have a strong local dimension where service the, and we always still remembering that coordination is only a tool, social protection is the goal. Thus, we have to keep sectoral specificities and undertake coordination only when the problems are cross-sectoral. As I said, we need resources to finance social protection. On the slide, you can see progress in social investment over the years. Nowadays, social investment in Latin America and the Caribbean represents 19.1% of regional GDP. And ECLAC proposal social compacts as the political tools at the country level to build long-term commitments for the adoption of universal social protection system. Also, we need to increase and develop state taxation capacities. Depending on the countries, if the tax burden is low, we can increase it, or we can undertake reforms to tackle regressiveness and consider rents from natural resources that have been those that have helped expand social protection in many countries and are now in question because of the lower prices. And also, we have to consider that in the region, financing combines both legacies from the past and recent innovation. So we have contributory models, some have a solidarity component, some do not have, and in most countries the great strides have been made on non-contributory models. To final thoughts, there is no single roadmap for moving towards universal social protection. Countries, obviously, depending on their economic, social, technical, and political structures, have made progress, but in different ways. The common progress. And we have seen in Latin America a period of steady growth and poverty reduction. Unfortunately, this period seems to have come to an end. There are new challenges, both political and economic, lower growth. Some countries are already in recession, and natural resources, their prices are going down. Thus, the relationship between economic and social development is always complex. Very often the idea is that when complex economic times come, we have to cut social investment, but we also have to think that social investment also has an important contribution to growth and to productivity gains. Also, a challenge is at the country level that very often the short-term vision that the government has that plans year by year prevails on the long-term vision to build a welfare state and to universalize social protection. This is a big challenge with an eye on the long term and on improving the realization of economic and social rights. So that's the final message. Although the region has made a lot of progress, we still need to continue to have this long-term vision and strengthen the welfare state. I thank you for the attention, and I think now we'll hear from our colleague.
Thank you very much, Simone, for your interesting presentation. We are receiving some questions already, so please go on sending us the questions so we can have the question session after the intervention of Sergei Soares. So Sergei Soares is a senior researcher at IPC-IG in collaboration with Ipea, which is the Brazilian Institute for Economic Applied Research. Applied economic research, sorry. So Sergei holds a bachelor degree in physics and also master's and PhD in economics from the University of Brasilia. And he joined the Institute, the International Policy Center in 2015. And he was formerly the president of the Institute for Applied Economic Research from May 2014 to April 2015. And he has been a researcher at Ipea since '98, working in the areas of inequality, poverty, education, racial discrimination, and the labor market. And his areas of expertise are economics and econometrics, with an emphasis on economics of welfare. And previously, he has worked at the Brazilian Ministry of Education and the World Bank in the field of education. So I will now pass the word to Sergei to comment on the presentation of Simone Cecchini.
Thank you very much, Alicia. Thank you very much, Simone. It was an excellent presentation. And I must say that the book is as good as the presentation. It's very good, particularly the second chapter in the book. It's an excellent chapter, and I have never read anything quite as comprehensive about the story of history and social protection. We are all, to an extent, slaves to history, right? And in social protection, this is as true as anything else. So where we are today depends a lot on how we got here. So the social protection politics are past dependent. That having said, let me make a few comments, specifically about the second chapter. About the, as Simone said, the second chapter spreads the history of social protection in, I believe, 4 or 5 parts, which would be, the first would be the liberal, export-led 19th century, almost non-existent social protection, then the import substitution model, then the adjustment model, and finally the new status primary export model again. So that's, I think that makes 4, right? Social protection really started seriously with the import substitution model. And this model gave us a good thing, which is a good inheritance, which is the idea that social protection has to exist. It has to be the role of the state. It is something which the state has to have an apparatus to do. But it gave us also a very bad inheritance, which is exclusive social protection. In every country, except perhaps Argentina and Uruguay, the import substitution model never got beyond a minority of the population. It was always for those that were included in the formal labor market, the formal urban labor market. The chapter says this, but I think it could mention this even, that the legacy that it gave us was a legacy of inequality in social protection, right? The adjustment model that came after had numerous problems, among them the fact that it was working trying to reduce desperately the size of the state, a little too desperately perhaps, and place perhaps excessive emphasis on targeting. But on the other hand, this emphasis on targeting also meant emphasizing getting social protection to the poorest people. Well, then we have the new status model, of course. And where are we today with our being slaves of history? We have a social protection system which, to my mind, is very far from being rights-based. We have a social protection system which today has a part of the included who get unemployment compensation, old age pensions, survivor pensions, and this whole package is something which in most countries in Latin America is something on the order of 10% of GDP. So it's not small. And this is usually for about half of the population. The other half of the population, what do they get? They get CCTs, which are, and CCTs and whatever else that they get is on the order of 1 or 2% of GDP. This is really, to my mind, a far cry from rights-based. I think rights-based should be something where definitely the poor should get at least as much, if not more. Obviously, there are counter-arguments that a lot of this is contributory, that the fact that this 10% of GDP isn't just involves giving back what was contributed by these people along their lives. Okay, I got that. But I think we need to move towards a social protection model that is more progressive. If you look at social protection, at least at cash transfers, you know, everything that's cash transfers, not just CCT cash transfers, you will find that social protection in Latin America is a far cry from being very progressive. In general, social protection decreases the Gini of income distribution at the margin very little. This compares to European countries or other OECD is highly progressive, where they take off, you know, 10, 15 Gini points off of the Gini coefficient instead of maybe 1, 2, or 3, which is the case in most of Latin America. So, I mean, that having been said, where I think that the book and chapter 2 of the book and the whole book, where does it leave us? It leaves us vying or striving for a fifth model, which we could call the post-statist, not natural resource model anymore, because the party is over with regards to the commodity price boom, and this has affected virtually every single country in Latin America. It's not just oil, it's not just soybean, not just copper, it's everything. All commodity prices have come down, and they've come down from very, very high levels, which nobody believes are going to be retaken anytime soon. So that leaves us with the history that we have, the institutional history, the technical history, the financing history, which the book is very, very good in emphasizing, all three of them. But it leaves us with an incomplete task, or a task which has not been completed, which is trying to build a model which really is rights-based, and which does not one for the formal sector and one for the informal sector. I think that the book is very good, if not too comprehensive, about financing. It's clear that there are some countries in Latin America, particularly Uruguay, Argentina, and Brazil, in which the tax burden is already quite high. We're talking 30-something% of GDP, which is several OECD countries, although lower than, for example, the Nordic countries. And this means that for these countries, it's difficult to argue for an expansion of social protection along the lines in which it goes, which means require even more taxation. We would have to go down to 40, 50% of taxes. I think in these countries, we have to talk about progressivity of taxes, but also progressivity of benefits. And we have to think about why is it that in many of these countries, for example, civil service pensions, which are extremely regressive, make up a considerable proportion of social protection. And to finalize, I think we have to look at the adjustment model of the 80s and be very careful not to repeat the same mistakes. In many aspects, the adjustment model of the 80s mirrors the situation we're in right now, which is revenues are falling, growth was high, and then it's come to a stop, or at least it has slowed down. And we have to think carefully about how we are going to adjust. We're in a new adjustment era. How we're going to adjust while maintaining social protection for the poorest and the neediest. Who knows? Maybe if we, navigate this post-status model well, we can get to a point in which we will be looking at a more rights-based approach in a few years, in spite of the fiscal restraints, than is the case today. That's it. Thank you very much. And great presentation, Simone.
Thank you, Sergei, for your intervention and for your interpretation of the situation in Latin America. So we would now go to a lot of questions, and we cannot, because of the time, we cannot answer all of them. But I will start with some questions for Simone we received. So one has been sent by Francesca De Segli. So the question is, compared to other regions of the world, Asia, East Africa, etc., it seems that Latin American countries, Latin American and Caribbean countries do not have extensive public works programs in their social protection systems. Is that so, and why is it not a widely used instrument? Then another question we received from Atif Kership is, in many of the programs you have reviewed in a middle-income country, what is the best mechanism for targeting? So World Bank is promoting proxy means testing, but it's expensive. In your opinion, what is a good way of targeting a Latin American and Caribbean region? And I will include a third one, and then Simone can go ahead with answering these questions. And Sergei, please feel free also to add anything you want. From a question from Jimena Garote, what is the role of the legal framework in promoting and or impeding the progressive expansion of social protection coverage. Simone?
Yes, I'm here. First of all, thanks for Alicia and thanks to the participants for the questions, and especially thanks to Sergei for the great comments. Now we don't have much time, but I think what he mentioned, that we now have to think of social protection in the region, what model are we going to follow, and how to actually have a rights-based model in the region is a big question. There are discussions. We know there is ILO recommendation 202. We talk about basic universalism. Santiago Levy from the IDB has proposed for integration. So I think that's a big open question that we will not solve in this short web seminar, but it is important to keep it in mind. With respect to the three questions mentioned, first of all, on public works, it is correct that, let's say, while in India you have huge public work programs with millions of people in it, in Latin America that is not the case. Public works were very important after the debt crisis. When the crisis hit, countries actually implemented public works programs with the big limitation that there was not an existing portfolio of investment in projects in infrastructure. So these programs, although they were not evaluated very deeply, they didn't have a good story, because either they did not have a great impact on the infrastructure that they were supposed to build, or they had this, for sure, short-term achievement of keeping a basic level of income for people, but with no longer-term effects. Now, if crisis hit the region and if public resources are available, maybe public work programs could come back with some of these lessons learned, but we shall see. The second question is, again, a huge question on targeting, right? As I said, universal policies, we concur that it is important to target, to include the poor and specific groups, and to move them towards universalization. Now, which are the best targeting tools? This clearly depends on country conditions, because the fact that they are deemed, many of the targeting tools, they are deemed expensive, say proximity tests, it is true up to a point. It depends, because in a country like Mexico, the data available, a country, for instance, that has one of the strongest statistical institutes in the region, with a lot of computer power, for instance, and human resources. Sure, there was some investment made in the first years to have targeting measures and social beneficiary registries, but those costs actually over time decreased. So in the countries with good statistical and systems, good level of ICTs and human resources, you can consider having proximity tests. In other countries, targeting makes more sense, because also we know that very often when you get to the ground, if you use proximity tests and you go to a rural locality, when you start discriminating between families and people do not understand why they got in or out of a specific program, then it could be better to just target the entire rural communities. It's a geographical targeting or categorical targeting, targeting the children. So that has to be kept in mind according to the country situation. In Latin America, one of the countries that further progressed on this issue of targeting, Chile, has now just changed its social protection card, making it more simple and cross-referencing data coming from, say, taxes or other administrative registries. So depending on the level of development of administrative registries, that's also an important avenue. And if I recall, it's about the legal framework, but I didn't succeed noting it well. Alicia, would you mind repeating the question to me?
Sure, Simone. Let me look for it again. So the question is, what is the role of the legal framework in promoting and or impeding the progressive expansion of social protection coverage?
All right, thank you. Well, definitely the legal framework is key. I mean, if we see progress in social protection in Latin America, it is on the one hand because the region grew and we had resources, but it is also because the region underwent democratization. We had more democratic constitutions, for instance, in Brazil 1988, Colombia 1991, that explicitly set countries on a path towards extending social protection and having a rights-based approach. Now, as Sergei said, we cannot say that necessarily the region has adopted a rights-based approach because it's written in the constitution or in laws, but in those two countries, for instance, I would say that some progress have been made. I mean, in Brazil, the social non-contributory pension for the elderly and the disabled, it's quite big. It reaches a lot of people. Definitely, if we then compare the benefits received for those participants compared to Social Security, well, there are huge inequalities that we have to fight. But progress has been made. The same in Colombia with the health. Thus, I believe that we still have to make progress on the institutional framework, be it with laws. Social development laws have been adopted in countries like Mexico, but also in weaker countries like El Salvador recently adopted the social development law. That those laws make us feel that we are part of a state, a country that wants to progress in a certain direction. That's the difference between having just policies taken by the institutional framework and having a strong institutional framework. It's like the sign that we are progressing towards a common project. I think that that is one of the main messages, together with mentioning that in social development and social protection, some ministries are stronger historically, Ministry of Labor, Education, Health, and now the social development ministries, although they do not exist in all countries, are growingly present and play a key role in the fight against poverty. So I think we should always keep in mind the importance of the legal and institutional framework. Thank you.